Hey guys, I'm going to talk about contraindications. Contraindications, what is that? That is the things that's going on with your client that will prevent them from having the procedure. So I'm going to go over those things, and all of those things are going to be in the consent form, but I'm going to talk to you about it to explain to you a little bit more why is it the contraindication, why it is what it is. So you need to make sure that every client fills out a consent form, and I'm going to give you with my training the consent form that I use, but you need to make sure that you have your lawyer, your attorney checks, make sure that it's fully protecting you from the legal standpoint of your state or where you live. Just make sure you do that. Please don't use my consent form and have me obligated to all of the things that may happen in the future. Please make sure you take care of that yourself. But I'm going to give you what I use, my consent form, and why it is what it is. I always have my clients to fill out a consent form and have one copy mailed to them. I have an automated system where I use a smart waiver company. It's an online company where I have my consent form on the iPad. They fill it out, it saves, and it emails them the copy if they want it, the client. So it's a good one to use. There's many others that you can do research and find something that works for you, but I definitely recommend that you find like a company that's something that you can do online on the iPad, so that you don't have to keep all of that in the form of paper. So I use smart waiver. You need to make sure that every client that walks into your door fills out a consent form. You don't touch a client until they fill out a consent form. That's going to protect you, and that's going to protect your client. And it's best to go over all the things during the consultation appointment. So if there's any problem, that if it comes up, that you plan for it in the future. So it's good to, if you're seeing the client for the first time, it's good to have a consultation on a separate day from the appointment, because the appointment is 3 hours. And if there is a problem with the consent form, then that means that you're going to lose that 3 hours of your day. Always ask every client about their allergies, and if in doubt, perform the skin patch test. It's normally done behind the ear, and I already talked about it. Make sure that they're not allergic to anything that you're going to use on them. Make sure to consult, and I already said, with your local regulating authorities about additional information that you have to keep on file for each client, because some states will require that you keep the number of ID, like the state of Georgia, for instance. There's a requirement that you have to keep the number of their ID on file. And also, as I already said, consult with the attorney about putting together a consent form that will best protect you. When we talk about all these diseases and contraindications and all of these things, you need to make sure that you understand that we as permanent makeup professionals, we're not allowed to treat or recommend any treatments for infections, for diseases, abnormal conditions. If clients have problems, you need to refer them to their physician. So what are the contraindications to permanent makeup procedure? First is pregnancy or nursing. Always. We don't touch pregnant ladies. We don't want to take that responsibility. Pregnancy or nursing. Cancer, chemotherapy. The procedure must be performed at least 6 months after the last treatment, and with a note from the doctor to allow it. So that's an absolute contraindication. Current infection or fever. So if there's any infection going on, fever, person is sick, they have to get better before the procedure. Diabetes, the form where the client has to take the insulin shot. The procedure can be allowed with a note from a doctor. Also, some clients will say that they have pre-diabetes or they have a diabetes type where they don't have to take the insulin. In that case, you're going to see that they're going to heal very slow. Those are people with diabetes, they're very slow healers. So usually if you have a client, let's say they're supposed to come back to you in a month, you need to touch bases with them after a month, maybe schedule a consultation or something and see where they are in the healing phase, because most likely they need maybe a lot longer to heal, a lot longer. Any disease that prevents blood clotting, so that's a contraindication. Any type of uncertain skin formation, growth, moles in the area of the permanent makeup. Yes, any type of uncertain moles, I already talked about it. We don't go over anything that's uncertain over there in the area of the procedure. Any type of skin disease or infection in the area of future permanent makeup. Allergies to ingredients in the pigment or anesthetic. I already said, if in doubt, do the spot test behind the ear 3 weeks before the scheduled procedure. High blood pressure. It is recommended that medication to control high blood pressure be taken before the procedure. The reason why with the high blood pressure is because there's going to be a little more bleeding. Epilepsy. You certainly don't want to be in that situation when there's when someone has a problem and you have to deal with it. So, contraindication. Severe psychological disorders. Hepatitis C or HIV. And of course, I teach my students, and all of you should work with every client as if they're potentially carriers of those diseases. You never know who has the infection, and you can spread the infection to other clients or yourself if you're not careful. So remember that your client's health is in your hands. If the patient is under control of drug influence or alcohol, that's a contraindication. Botox injections that are less than 3 weeks before the procedure. Sometimes people ask me, why is that? Why is it 3 weeks? Because it takes time for the Botox to set, and when it's setting in the muscles, the location of the eyebrows change. I don't know if you know or not, but Botox can lift the eyebrows in certain areas. So the Botox injection has to be completely taking the effect, and that takes sometimes complete 3 weeks, so that the location of the eyebrows is accurate. And if you need, sometimes people also ask, what do you do, the permanent makeup or the Botox? What do you do first? I say that whatever the client, the usual state of your client is, if they get Botox all the time, so they need to be in their normal state, the way they are all the time. So if they get Botox, they need to come to you with the Botox, and you do it, and that's how it's going to be. Or if the client never had Botox and they're planning on getting that, but they're not usually getting the Botox, it's not their normal thing, then it's better that they come to you in their normal state with no Botox, because when it wears out, it's going to go back to where it was. Next, keloid scars. We'd already talked about keloid scars. That's a complete contraindication. Accutane treatment within the past 12 months. What is Accutane? Accutane is a medication that they prescribe for, the doctors prescribe for the acne. So it has to be 12 months since that medication for you to do the procedure. Recent chemical peels while the skin is still peeling or flaking. I already talked about that part as well. Recent use of Retin-A that's causing skin to peel or flake. Sometimes clients that come and their skin is fine and they say they use Retin-A or retinol. There's going to be different forms of that Retin-A, and it's many times it's a component of many skin anti-aging treatments. So if it's not a high enough amount of that Retin-A, it's fine. It's fine. If the skin is not peeling, everything is fine. But always tell your client to stop taking Retin-A at least like 1 week before the treatment, before the procedure. The use of blood thinners such as baby aspirin can cause bleeding and poor results. If your client's physician allows your client should stop taking baby aspirin, or if they're taking baby aspirin all the time, 1 week before the procedure, and then they can resume taking that right after the procedure. If a client has cold sores, HSV1, they should be taking Valtrex or similar drugs prescribed by their physician before the permanent makeup of the lips, because the procedure can cause the outbreak. It is better to avoid permanent makeup procedure during the menstrual cycle because your client may be very sensitive during the cycle. Also, I have to say that I always ask my clients to stop taking any type of blood thinners beforehand, before the procedure. That includes fish oil. Fish oil is a blood thinner. Fish oil or anything else that can be a blood thinner. Also wine, even a glass of red wine before the night before the procedure can cause that blood thinning effect. So we always say no alcohol 24 hours before the procedure. No coffee also. Coffee will increase the heartbeat and it will increase that potential for more bleeding during the procedure. Yeah, I think that's it. That's all that we had to talk about today. So I really enjoyed our session today. I hope you did as well. And I will see you in our next lesson.